Hi, everyone. I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thanks for joining us in the Veterinary Breakroom. In the break room, Dr. Beth and I just have short conversations about things that are going on in veterinary medicine today. And our topic today is definitely a serious one and a little bit sensitive. So just to kind of warn people about that. We are going to be talking about terminal surgery labs in the context of veterinary education. The reason this came up is because there was actually a recent article in the VIN News Service about terminal surgery labs in practice. And I was actually quite surprised at the number of universities that are still offering this type of training. So I'm a 2003 graduate from ISU, and I did have a terminal surgery tract or, education where at the end of surgery training, the animal was humanely euthanized and not recovered from surgery. But that was, like I said, in the very early 2000s, and I had thought that all universities had kind of moved away from that. And I was a little surprised to learn that some are still offering it. So we wanted to talk a little bit about it today, talk about our experiences with it, because it is something that I have personal experience with. However, I don't think you do, Dr. Molleson. So Beth, did you have a terminal surgery tract when you were in school?
We did not. I keep my memory so bad. I'm like, did we? I think I'd remember that. And no, I think I would remember that. I graduated in, let's see, quizzing my memory, 2011. And no, we didn't have any terminal surgery labs. So I'm not super familiar with even how that works, Alyssa. So I'm curious to even ask you at some point if you'll explain to us what that looked like. What procedure were you doing on these pets, or did it vary?
Oh, yeah. So it did. It varied. This was an entire semester long class, and we were in a group of three. We had the same group for the entire semester. And for each surgery, which I think it was weekly, I can't, again, my memory too, I had to really sit down and think about, like, what did this course look like? I have some vivid memories from it, and we can talk about those, some vivid memories about not only like how I felt about it, but what I think, the learning opportunities were. But anyway, we had a group of three. So each week within your group, you rotated. So you were either the surgeon, the assistant surgeon, or the anesthetist. Okay. And so that rotated each week. And we started the beginning of the semester with, more straightforward abdominal surgeries. And it progressed. The surgeries, got more technical and difficult till the very last surgery that we performed was a thoracotomy. So we did go into the chest of these animals. The animals that we used were slated to be euthanized. They did come from a shelter setting. This is where this becomes very sensitive, and people have really different views about what's ethical and what's moral in the treatment of these animals. And we can talk a little bit about that. But these animals were going to be euthanized anyway. And so the prevailing thought was that if they were going to be euthanized anyway, and we weren't going to be waking them up, they weren't going to have things like postoperative pain or anything like that. They're anesthetized for the procedure, not feeling anything. Is this a justifiable use in the training of veterinarians so that they can go on and then use these skills later for the betterment of the profession? So that's kind of the crux of it. Do you have other questions about how the lab worked?
No, that's interesting. As I was reading some articles about this, I saw some places that seem to do like staged interventions on these pets or animals, where they would, maybe the first series they would fix wounds, and then they would wake the pet up and take care of it, and then they would spay it, wake it up, take care of it, and then they would finally do the terminal surgery, which to me seems like a very different scenario than what you described. I'm sure there's all different ways of doing that, but I almost feel like I have two completely separate feelings on those things. So it's interesting to hear how it was done where you were.
Yeah, yeah. I agree. I read that as well, and that gave me pause because we did not do
Hmm.
that. We did
Yeah.
not, recover animals at all. One of the things that it really, I had never thought about this until reading, these articles and reading about some of the newer models and things like that, and reading about different, students' feelings. There's, as this has our idea and social regard for animal welfare has progressed over the years. There have been petitions, there have been other writings about this, and really looking critically at these practices, which I think is wonderful. I think it's fantastic. We should always go back and examine what are we really getting out of these. But something that popped into my mind that I didn't quite think of until reading this was the idea of, performing a euthanasia in an animal that, potentially could have gone on to live a much longer, fulfilling life. Like I said, these animals were slated for euthanasia. And so we were using that as a training opportunity. But we were responsible. Our group was responsible for actually administering the euthanasia solution at the end of the lab. And so even gaining that experience, I don't know, it occurred to me that within, just a year or a year and a half of that lab and that experience, I was actually in real world practice. And I was
Hmm.
actually in the situation where I had an owner that didn't have the financial ability or didn't have, reason, and I'm presented with an animal that I need to humanely end its life and its suffering, but not necessarily that it could not have been saved. And so
Sure.
I wonder if there was, some learning that went on that we're not even really, focused on in how we approach humane euthanasia and end of life care as a relief of suffering. And maybe that is just influenced now by the fact that that's what I do, most of the time. I
Hmm.
think most of our audience knows, I'm a part-time in-home euthanasia and hospice care provider. So I don't know, that came to mind.
Sure. Yeah. And this is of course an incredibly divisive topic. I liked when I read more about this that it seems like programs that do still operate these labs, it's often a choice for students. So I think that is a great step to take where I mean, even in my own mind, I can certainly rationalize it both ways. I think you can say these are pets who, yes, they're slated for euthanasia, but does that mean um, they can't consent to these procedures that we're doing on them? Is that crossing the moral threshold for me? Or is it sort of like you alluded to, Alyssa, do the means justify the ends where um, this pet is going to be euthanized anyway? Are we actually making this life much more valuable by teaching skills through these procedures that the students otherwise wouldn't have, skill set that they otherwise wouldn't develop, and therefore a skill set that they otherwise wouldn't be able to bring to practice and help animals who aren't going to be euthanized and animals who do desperately need your help? I certainly think you can argue for that as well. Um, I think certainly an interesting thing that has entered the picture recently and may be why these programs, it seems like, continue to get more and more less frequent in the universities is the fact that we have with 3D printing and advancing technology, there are a lot more different ways to gain some of these skills and techniques without it being on live animals and therefore diminishing the need for these terminal labs. So I thought that was really interesting too. I know I toured my old vet school a few years ago and they showed me their procedures lab, which when I was in vet school, it was just like you would imagine some metal tables and some equipment. This procedures lab had full-sized animals, like things that looked like not real horses, but essentially real horses. All sorts of technology that has changed, that I could see these students are gaining a whole nother set of skills that I didn't have. And I mean, yeah, Alyssa, even just highlighting your experience in vet school versus mine, the only surgeries I did on a pet before I graduated were spays and neuters. So, of course, my skill set was pretty limited there. There was no necessarily real way to replicate any of the other surgeries that I remember, at least. Again, my memory. But yeah, I think that's one way this conversation has changed in recent years, are all the advanced simulation and model-based training tools that can effectively teach these skills.
Every cat's visit to your clinic is an opportunity to spot the subtle signs of osteoarthritis pain. When you diagnose OA pain, be confident in recommending Silencia, Frunevetmab injection. Monthly Silencia controls the pain of OA in cats, helping to improve their mobility, comfort, and well-being. Turn one-time visits into lasting partnerships. Visit silenciavetteam.com to learn more. For use in cats only. Women who are pregnant, trying to conceive, or breastfeeding should take extreme care to avoid self-injection. Hypersensitivity reactions, including anaphylaxis, could potentially occur with self-injection. Silencia should not be used in breeding, pregnant, or lactating cats. See full prescribing information at silenciapi.com.
Yeah. And I think, when I think about models too, like I think about, oh, we're going to suture on a banana skin, because like that was the models that we have. And these models are not like that at all. These models are incredible. Like they actually have vasculature that run fluid through them and things like that, where you can monitor blood pressure, and you can actually simulate something like a bleeder. And so it's just incredible what technology allows us to do now, because that was always my real crux when I heard about people being trained, even on cadavers. It's like, there's such a difference, and I love surgery, but there's such a difference between working on a cadaver or working on a model and working on, a live patient that has the ability to bleed. I said I have some very vivid memories from this surgery lab, and that was one of them. So I was the surgeon in my group, and we actually this was early on, and we were doing hollow organ surgeries. And so we spayed and neutered even if we did a different procedure, I'm pretty sure we spayed and neutered all of them too. So it was like, double, what was going on. But I remember my instructor, I was doing a spay, and I had exteriorized the uterus and one of the ovaries, and my instructor walked over and he took the scalpel from me, and he cut the ovary and dropped the pedicle back into the abdomen. And he was like, whoop, you just dropped a pedicle. You need to go find it, and that was something that at the time scared the bejesus out of me, but it's something that has helped me, or did help me, or I feel like it helped me, because when it happens to me, and it has happened more than once, something tears, something is bleeding somewhere, I know too that I can handle that situation, and I take a deep breath, and I extend my incision, and I go find it. And until that happens to you in real life, I don't know if there's any way to simulate that.
Sure. Yeah, I would say nothing replaces real life experience. So I did see an interesting, it looked like maybe study that was done at Kansas State, or maybe just evaluation, where they compared two groups of students, one who had done more focused technique skills on, again, those training tools, inanimate models of any kind, versus a group of students who had been in this terminal procedures lab, who had done all sorts of different procedures. So they weren't as focused to the procedure that they were going to be analyzing at the end of the study, but just sort of had more broad-based surgical experience, and they compared the performance of these two groups of students on a certain surgery. And it looks like that student group who had been doing the model-based skills techniques actually performed better. I didn't get into the details of the study to see what the metrics were and what the procedures were, but I thought that was really interesting. They said that that sort of wound up being the end of their terminal surgeries lab, because they saw that there was a different way to get the same outcomes or even better outcomes in their surgery students.
Yep. Yeah. So I thought that was awesome as well. Although, again, I did think at the time when I read it, that's great when we do have a positive outcome, but it made me kind of wonder, so what happens if we don't have a positive outcome? What happens when we have that drop pedicle or postoperative hemorrhage or incision dehiscence, on these animals? Those things are going to happen, though. They're going to happen in real life. They're going to happen in practice. They're going to happen at some point. And so, I do think having that combination of approaches, just like we're talking about, models aren't going to replace it, but maybe rotating in a heavier emphasis on, spay neuter programs or dental labs. I think the real emphasis should be on, lots and lots of time with those procedures and learning the tissue handling and everything like that, just like you said. But I think surgery should start earlier, in the veterinary training. I think we should be starting with surgery principles freshman or sophomore year, and not waiting until clinicals or fourth year.
Mm-hmm. Yeah, I think certainly there's fine line when we discuss all this. I know also maybe beyond the scope of this conversation, but there can be, I know, real challenges in trying to procure cadavers for cadaver labs. So I think as people society becomes more and more protective of the morality surrounding animals and their use in education, I think it is important that we don't look at that with just one lens, that we look at what the end result of it is and make sure that when we are maybe limiting some of these opportunities, that we don't do that without looking at ways to then maximize other opportunities, again, through some of the things we've talked about. And if you're wondering what the AAVMC's take is on all of this, they say that they emphasize refinement and alternatives. So the handbook stresses what they call the 3 R's, which are replacement, reduction, and refinement. So essentially encouraging schools to use alternatives like models, simulations, or cadavers whenever feasible. So that sort of explains why we do have a mix of different teaching methods out there.
Yep. Yeah. I think it's very important. So, well, thanks everybody for joining us on this conversation today. And we will go ahead and link a couple of those news service articles for you as well. And there's a really nice one on different models that are available, these days. And so that was interesting to see. Do we want to do a win of the week, Beth?
Sure. You start, Alyssa. What's your win this week?
My win this week, I don't know if you all remember a few weeks back, maybe a month or so back now, we did an episode on aquamation. And actually my practice has started offering aquamation to all of our clients here in Las Vegas. And so we're super excited about that. If you haven't checked out that episode and you want to learn more about aquamation, I encourage you to do that. But this was a big step for our practice and our company, and we're just really excited about it.
Congrats. I know that's been a long time coming, so that's great.
Yep. How about you?
Yes, my one of the week is taking place tomorrow, I hope. That is that Paul, my dachshund, is doing his 10th Oktoberfest Wiener race. So every year, Cincinnati's Oktoberfest, which I think they say is the biggest celebration outside of Germany, is they kick it off every year with this 100-dog Wiener race where all the dogs dress in hot dog costumes. And Paul has done it 10 years. He did make it to the finals one year, He is now 12 and a half, so I don't necessarily expect an actual win, but for me, it's a huge win. Every year that we do this is a huge win that he's here and healthy enough to do it. So I'm excited. I'm trying to keep my expectations low. We're going to go and have fun. And it's always a blast. Anytime I'm around 100 dachshunds, I'm in heaven.
Yeah. Yeah. Well, we all expect pictures of Paul, so.
You got it. I'll show you one of the many hundreds I take. But all right. Well, to our audience, thank you so much for listening in. We'll catch you all next episode.
Thanks for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Veterinary Breakroom is an Instinct Science production produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.